Good afternoon. I'm pleased to have the opportunity to present here the fourth or third progress report in the Translational Medicine course. I am Bence Stubnya. I'm in the orthopedic and traumatology residency in the orthopedics clinic, Department of Orthopedics, and my supervisor is Zoltán Bejek, and my scientific pathology supervisor is Szilárd Vancsra, and the statistician is Gergely Agocs, whose work I'm really helpful. Well, my PhD topic is about the total knee arthroplasties regarding the surgical approaches, and to find the best surgical method, we conducted two investigations. The first was a literature search and literature analysis, and the second was a retrospective analysis of a prospective clinical database. And the third project is to build a total knee arthroplasty registry here in Hungary or in the Central European region. So the first project is about to compare the safety and efficacy of different surgical approaches in total knee arthroplasty. Why is it an accurate and important question nowadays? Because the estimated growing numbers regarding the total knee arthroplasties is about 500% increasing in the upcoming 20 years. And I will show you on the last slide that it is 300% in Hungary in the last 10 years. But there is still no consensus about the more effective surgical approach. We had a clinical investigation where our finding suggesting the quadriceps sparing approaches. So the aim was to define the best surgical method in total knee replacement therapy regarding the clinical outcomes. So the first study was a systematic literature analysis where we found more than 1,000 articles before duplicate removal, and after we have found 32 articles eligible for full text analysis. We investigated 3 different outcomes, one of the range of motion. We compared all the other approaches to the standard used medial parapatellar approach. So in the column, you will see that the black line means the medial parapatellar values. All the little boxes could be found on the right side of the black line, means that this approach could offer better range of motion than the medial parapatellar approach. So you can see that on the left side of the slide, that especially in the first week, the so-called quadriceps sparing approaches, especially the subvastus and mini-subvastus, really could offer a better range of motion in the early postoperative rehabilitation days. But as time passing away, we found that this difference is decreasing, and after a year of the operation, there is no significant differences between the used approaches. The other outcome we have measured was with pain. It was the pain measured with visual analog scale. The visualization is almost the same as the previous side, but the better means the left side. So if the boxes on the left side from the black line, that means that the patient had a little pain. we found almost the same, that the quadriceps spurring approaches really could offer lower pain values than the standard use medial parapatellar approach. The other, or the third outcome parameter was the knee society score system, where we have not found any significant differences between the two groups. The knee society score is to see the patient's health, the patient's life circumstances after the surgery. So all in all, we can say after our meta-analysis that we followed a well-defined strict study protocol, but there is some limitations of our study as well, because our network matrix is poor regarding the little amount of the randomized controlled trials. But we can say that subvastus and mini-subvastus approaches really could offer or really could support faster rehabilitation than the standard use medial parapatellar approaches. The second project is a retrospective analysis of a routinely and prospectively collected clinical data, which we conducted at the Department of Orthopedics. The meta-analysis is right before the internal review, and this clinical investigation is sent to an internal review, and we found measuring the patient in two groups. Group A was subvastus group, and 2B was the medial parapatellar group, 50 patients in each group. There you can see the demographical statistics, where there is no significant differences between the two groups. The first outcome was the range of motion, where we found significant differences on the first days, but as time passed away, these differences decreases. So that means keeping the quadriceps muscle intact really could help faster the rehabilitation. The second was the pain measurement using the same visual analog scale as we investigated in the meta-analysis. We found significant differences regarding all the days spent in our department, but the shown difference is decreasing as time passed away. We investigated the pain values in during active movement as well, and we found significant differences between the two groups. In each group, the pain values decreased as time passed away, but the differences between the two groups was significant on the day 6 as well. In conclusion, we can say that based on our findings, subvastus approach is superior to medial parapatellar approach regarding to range of motion and pain and painkillers need as well. Yes. For some reason, the meta-analysis manuscript status slide is found here and is going to be sent to internal review in some days. And the third project is a total knee arthroplasty registry, where we started to thinking about the registry in a way to investigating the last 10 years in Hungary. So we analyzed the total knee arthroplasties implanted in Hungary from 2010 to 2020, and we found that there is a 3x increasing just in 10 years. So all in all, we can say that the need of total knee arthroplasty is giving a higher and higher burden for our society all over the world. And we are just trying to find the best method to our future patients. Thank you.
Congrats, Bence. I'm pretty sure that patients with knee problems will have a better life after your results.
Congratulations from my side as well. Just a technical advice for you. You projected a lot of results on your results slides. And when you are talking about it detailed, then you have to show it for us. Otherwise, we lost. So there is a pointer with you or cursor, so you have to use it just a technical point of view.
Thank you very much.
Question actually, Bence, because we have plenty of time. Of course, it's not an easy job to build a registry. I'm pretty sure that you have a plan for this. Also, we advise everybody to start registries, but what will be your approach based on these results from the past years? How many knee surgeries were there? Sorry, prosthesis surgeries, because these are not general knee surgeries, but how can you actually build a good registry based on this?
Well, we conducted 3 different study or investigation focusing on the different point of views of the total knee arthroplasties. So we can say that right now we have a really good probably knowledge about the total knee replacements world, and to the tenders and to some financial support, it is really important to make the importance the total knee arthroplasty registry with numbers, and our numbers absolutely showing that the total knee arthroplasties burden is increasing year by year, especially in the last decade. The number of total knee arthroplasties were implanted in 2010 was around 4,000, and in the last COVID-free year in 2019 the number was 12,000, and the number of the operation theaters and the number of orthopedic surgeons could not follow this increasing in the implantation numbers. So we really have to find a way how we could fasten and make the process faster to give more total knee arthroplasties to the Hungarian population.